Greetings. Welcome to session 6 of the Emerald Choral Academy. I'm Gary Cannon, the artistic director of the Emerald Ensemble, a professional choir based in Seattle. The Emerald Choral Academy is a series of interactive webinars during which our area's leading professional choristers reveal their personal tricks of the trade to community singers. These webinars are then made freely available to singers across the world via YouTube. The Emerald Ensemble is very grateful to our generous donors who have made this project possible, particularly For Culture and the Seattle Office of Arts and Culture. We encourage anyone participating or viewing this webinar to make a donation as you are able at emeraldensemble.org. You can also subscribe to our YouTube channel and join our mailing list to hear about future sessions of the Academy and the other activities of the Emerald Ensemble. This webinar is being recorded. By participating, you are granting the Emerald Ensemble permission to share your contribution. Your microphones and cameras will remain off for the duration of the presentation. You can, however, ask questions to the presenter by typing into the chat or the Q&A features at the bottom of your screen. And periodically, I will interject to field your various questions. We do have many more registrants at this session than in the past, so please forgive us if we do not address all questions during the session itself. Our presenter today, though, has said he's willing to stay a little later to answer what questions we can't address right away, or we can answer them via email as well. You should have recently received a confirmation email that includes a PDF handout. I see my cat is curious about the proceedings too. You may wish to access that PDF presently, and we'll also post a link to that, I think, in the handout in the chat window. This session's instructor is bass baritone J. Scott Kovacs, who is one of Seattle's most prominent choral musicians, active as a chorister, soloist, conductor, administrator, board member, festival coordinator, voice teacher, and executive director of both the Medieval Women's Choir and the Emerald Ensemble. Did I leave anything else? A composer and arranger there.
Yeah, there's that too. I do compose and arrange sometimes as well, yeah.
If you have sung in a Seattle area choir, I guarantee you that you owe thanks to Scott for something. And on top of that, by the by, he is one of the kindest souls you will ever meet, I guarantee. His topic today is The Singer's Guide to the Aging Voice. And it is a great pleasure to introduce to you my colleague and my business partner, but more importantly, my dear friend, Scott Kovacs.
Well, I now know what I look like when I'm blushing, because that was a very flattering introduction. I just stay busy and hope that what I'm doing benefits the choral community. So I'm grateful for that. My name is Scott Kovacs, and I'm really I'm excited to be here with all of you today. And as Gary was talking about all of this sort of Seattle things that I'm relative to or related to, it occurs to me that many of you are actually on the East Coast, which is why we had so much confusion today about daylight savings and the amount of the actual scheduled time. So I just want to acknowledge that we have participants from as far away as North Carolina and Maine and Vermont and into California and I think even some of the southern states. So I just want to, oh, hi, Anya. I just want to...
In Britain, even, as I understand.
Yeah, and we have one or two folks that are in Great Britain. So there we go. There's our Great Britain
Anya.
person.
This is how you all learned that I am the official evil genius of the Emerald Ensemble.
Yeah, we really do have a worldwide reach with the Choral Academy right now. So I just couldn't be more excited to share that. Oh, and then fly overland, absolutely. So I'm going to get started. Actually, if that's let me see here. I've got to see if I can get to my slide presentation, and I hope you can all see. Let me see here. How can I go about I think I have to hit this button, right, Gary? Is that what we decided? All right. So the Singer's Guide to the Aging Voice, it says, and I'm going to start with a disclaimer. And the disclaimer is partly because, let me just start with the disclaimer. All the information in this presentation is intended to be informational. It is not intended for the purpose of diagnosing or treating medical disorders. The Emerald Choral Academy is not responsible for conditions that require a licensed professional for diagnosis or treatment. If you are experiencing symptoms that might require a diagnosis, please seek medical attention. I am also aware that in our audience today are a number of voice professionals and a number of medical professionals. So this presentation is not intended to replace your communication with your voice professional, whether that person is a speech language pathologist, a voice teacher, vocalist, or a doctor, a physician of any kind. So just please be aware that I am not a medical doctor, and I'm not playing one on TV in this particular case either. So with that, we'll get started. Generally, when we talk about the aging voice, we're speaking about human beings that are over the age of 64. That doesn't mean that we don't experience the symptoms of change and age at an earlier point. In particular, women experiencing the symptoms of perimenopause or menopause, this may happen significantly before age 64. Voices do change. I've had a number of students come into my studio and say, "Oh, but I'm a soprano." Well, you perhaps sang soprano your whole life, but the changes, the physiological changes to the voice sometimes mean that you may not sing soprano as much or as easily, and the voice just does change. For men, it often happens a little bit later. Sometimes singers, especially professional singers, refer to each other in terms of a shelf life. Bass baritones like me tend to have a longer shelf life that extends well into the 60s even. It's not a necessarily kind or appropriate way to refer to the idea that our voices do change as our bodies age. So it's something that we just have to keep in our awareness. Singers who stay active using their voices generally are able to sing longer. The subsystems and the systems of singing are largely muscles. It's large involve muscles, and like an athlete who stays active in their sport, we are more likely to stay resilient over a longer period of time if we're staying active. A number of people have come to me that have said, well, I stopped singing for 10 years while I was working on my career. There was a lot of sort of rebuilding that has to go on, and then there may not be that longer lasting resilience afterwards. So keep singing, just keep singing. And we already mentioned that different genders' voices seem or tend to age differently. Limited amount of information is available for older singers. This is interesting. So there are very few textbooks that specifically cover the adult aging voice. There are a number of scholarly papers and other articles that can be found and referenced. I'm really grateful that both Kari Reagan and Nancy Bose have included chapters on or information on the aging voice in their books, as have several other folks. So a lot of what I know about the adult aging voice is through research, through other reading other professionals, voice professionals and medical professionals, and gathering that information and using it in practice in my own studio. This class is intended to be an overview. I am not going to get into a lot of detailed discussions about anatomy. Holly Boaz covered a lot of those in her Vocal Anatomy 101 and 102 classes earlier this semester. We may dig into anatomy later on, again, if we cover different parts of this class at a later point. if we more in depth. So this is just an overview. You do have the handout, which contains a lot of the vocabulary that is relative to the subject, diagrams of anatomy that are relative to the subject, and I've given you some of the sources that I refer to throughout today's presentation. And with that, Gary, I think we could go to the first poll.
Did that appear for everybody? Oh, good. People are voting.
Good. Well, while people are
right, this is the first Emerald Choral Academy poll. Yay!
This is just a little bit of demographic information for me, so that I know a little bit more about who I'm talking to. I just a little bit, but since I've been so bold as to ask you to tell me how old you are, I will tell you that I'm 51, and I'm experiencing changes to my own voice. My voice is very different now than it was when I was 35. I kind of like my voice, although I'm really bassy today because I didn't get much sleep last night. Was excited about our presentation today. My studio consists of all kinds of different. Oh, here we go. Here's the results. Well, this is excellent to know. Excellent to know. All right. Thank you, Gary. Thank you for putting that up for us. All right, moving along. There we go. I want to talk a little bit about the group of voice professionals and vocal health professionals that are important to know about. And in my little diagram here, I have arrows in each direction, because ideally when you are working with a voice professional or a vocal health professional, those people are either talking to each other or somehow sharing information, so that you get continuity of care and continuity of instruction and continuity of therapy as you are going from professional through different professionals. An ENT, ear, nose, and throat doctor, specialty deals with conditions of the head, neck, including the voice. There are a number of otolaryngologists in the Seattle area that do specialize in singing and the human voice, and that work with other vocal professionals specifically. They're often very hard to get into, because they have such an important specialty. And Seattle is a singing town. We have a thriving community of professional singers and amateur singers and hobbyists that do seek the help of such professionals. Speech and language pathologists are clinicians that assess, diagnose, and treat speech, language, social communication, cognitive communication. It's a very important component of what we're talking about, and swallowing disorders. And then there are voice teachers, professionals trained in teaching vocal pedagogy, repertoire, and technique. There are other specialists known as vocologists that have, and I think Kari Reagan has another term for them. Singing voice specialist. Pardon me, lost that for just a second. That are included in this sort of voice professionals category. It is important to know when to seek professional help. The statistics vary, that between 5 and 30% of adults over the age of 64, as we're talking about in general here, will experience some form of dysphonia. And dysphonia just means that there's difficulty in speaking or singing because of some sort of disorder. It's a very, very general term. But the general guidelines that I would give you about when to seek professional help is, first of all, when it hurts. And I generally talk about pain in the vocal mechanism in two different ways. There's sort of a sharp version of pain, which is an absolute stop now. Stop now. If you feel sharp pain, stop speaking, stop singing, and seek professional medical help. And then there's dull pain, which is sometimes more associated with vocal fatigue. If you've been singing a marathon 6-hour kickoff rehearsal or a 3-hour rehearsal without much break, or if you've started singing again after not having sung for a long time. It's the sort of ache of working muscles that haven't been used in a while, and also the possibility that the vocal cords are inflamed from overuse. In any case, it's another indication that you should stop the activity that you're doing. When you feel pain, stop singing. If it's very sharp pain, seek medical help. If it's dull pain and it doesn't go away, seek professional help. And that's the second item here. When it persists, if pain persists, or if your vocal difficulties don't go away, then absolutely seek medical help. Sudden changes to the voice, abrupt changes in pitch, in speaking tone that persist, sudden change, you cannot speak at all. There are a number of things that could be going on, but sudden changes to the voice are also a time to seek professional help. And then when the voice becomes unpredictable, when you realize you don't know when you're going to be able to rely on your voice to be consistent for you, either in rehearsal or in performance or in everyday speech, if you can't enjoy singing anymore, it's a good time to, if you are struggling to enjoy rehearsals and singing and being in, when we can finally get back to them, it's a good time to talk to a voice professional and seek advice about whether therapies can be engaged, or improvements, help, some sort of assistance in regaining your enjoyment of music and singing. And then lastly, anytime you think you need the attention, if you feel like you need medical attention for your voice, if you feel like you need professional attention for your voice, it's probably a good time to get that. It's probably a good time to get that. So with that, Gary, can we put up poll number 2, please? And let's just get an idea of how many people in the room have.
Before we do that, can I ask you one question that has come up that's pertinent to the notion of professional help? Someone was actually asking for names of ENTs who work with professional singers. I'm presuming here in Seattle would be your expertise, but how would, and barring names, how would one go about finding an appropriate professional?
I know of about 3 off the top of my head. I'm reticent to rattle them off here because I think one of them has already retired. But how do I answer this? We can get you the information. I also recommend, we'll give you a follow-up on that. How about that? I just want to make sure that I give you the best information.
Yeah, that's the one question so far. I will pull up the other poll presently, if I can figure out how.
And you can always start with your primary care doctor as a way to get a referral. Some of us have to have a referral to an ENT.
There we go. Is that
that's the one?
For folks?
Yeah,
looks like it. Okay.
While the poll is up, I want to hold up one. I don't know how well you can all see this, but this is a book, Singing Through the Change, Women's Voices in Midlife, Menopause, and Beyond. Nancy Bose, Joanne Bozeman, and Kate Fraser-Neely. This book is sort of changing the landscape of how voice professionals, voice teachers are helping and learning in the current, are learning to be more sensitive to women's voices that are experiencing change due to menopause and perimenopause. And then I also want to highlight a local voice teacher, local voice professional, Kari Reagan, who teaches at the University of Washington, has recently published a systematic approach to voice. It's been another very, very useful text in my studio instruction. Interesting. So about a third of us have sought professional help for our voice. Excellent. Gary, is it okay to move on? My little orange light is blinking. Is it okay to move on?
Yes, go ahead. Yes,
All right.
sorry. I had to find my mute button.
No worries. There we go. All right. So there are some very, very natural processes associated with the aging voice. I'd like to talk about a few of those, and I'm going to put some very specific words on some of these, and hopefully demystify them or make them unscary, which is or demystify them. So the first thing that I want to talk about as far as natural changes is a loss of elasticity in the vocal folds themselves. This is the process. It can be described with the word ossification. Part of it is that the muscle tone is changing, and part of it is that some of the softer tissues have been collecting over a period of time minerals and other substances that make them less flexible, and we call this process ossification. It happens throughout our lives. From the time that we're infants all the way through adulthood. It's just the effect becomes different when we're older. The loss of elasticity can be aided with warm-ups that involve stretching, just like stretching a muscle. So lots of hums that go like stretching a rubber band, rather than trying to make discrete discrete pitch change up and down. So gently warming up with as a way to sort of stretch the vocal cords gently is a great way to get things started. The second thing is the drying of tissues, and this is we notice this all over our bodies as we get older, is that our tissues tend to retain less fluid. This is certainly true of the vocal mechanism, and in the vocal folds, those muscles are very, very, very small. So when we're dry, when we're dehydrated, when tissues are drier, it tends to show up very, very quickly in the vocal mechanism, in the vocal folds in particular. So staying hydrated is a really important part of vocal health. Hearing loss, and I just want to talk a little bit about assistive hearing devices. I highly recommend, if you are a person that uses assistive hearing devices, having an audiologist that understands what it means to have assistive hearing device and be a singer. I'm very fortunate that my audiologist also has a degree in music. I have a partial hearing loss, actually a transient hearing loss in my left ear due to atypical Meniere's, and occasionally I wear assistance on my left ear. That particular hearing aid also has the ability to have different parametric EQ settings, equalizer settings. So I have an EQ setting that I use specifically for conversation, sitting in front of the TV. I have an EQ setting that is specific for rehearsing, and I have an EQ setting that's specific for sitting in a concert hall, listening to a concert, so that the specific frequencies that I need for those experiences are corrected for and amplified appropriately. So those hearing devices that just simply amplify sound are not going to be as helpful as having a hearing aid or hearing assistance device that can help treat for or supplant those specific frequencies that are missing and that are needed for those particular experiences. So, hearing loss does not mean that you cannot continue to sing. I have many friends and colleagues that continue to sing with both with assistance and with hearing loss in general. Vision loss can affect singing. It can. We have a hard time seeing the font on a choral score. I have a number of students that blow up their music, make sure that it's larger, so that they have less difficulty when they're reading their music. Changes to respiration. There's a loss of muscle tone in general as we age. So respiration, tidal breathing becomes a little bit more shallow. So we, as voice professionals, will work on making sure that we're maximizing both the looseness in the body to make sure that we have enough expansion in the rib cage all the way around, and to ensure that we always have primary control of the breath. There are changes to phonation in the larynx. That epithelium, that coating of cells, has a tendency to be one of those places that ossifies. That coating of cells around the vocal folds. Arthritis can certainly affect the way we sing. Believe it or not, arthritis can affect the small bones, including the hyoid and other bones within the mechanism, making things a little bit less cooperative. And then changes to the resonators. So as tissues dry in our sinuses and other places, in the sinuses in the throat, the ventricle, those places behave differently for us, and we have to relearn vowel placement and resonance and all of those other things as we age, to make sure that we're maximizing the benefit of our resonant spaces in our body.
Scott, can I interject with a great question about that last? You had demonstrated some exercises for elasticity. Do you have one or two that you prefer for muscle tone in the rib cage?
Oh, for in the rib cage, yeah. I'm a strong believer in remembering that that the base of all singing is breath and gas dynamics, and what I recommend is breathing in through a straw shape, and then using resistance through the teeth. So it's breathing in through a straw shape and hissing out through the teeth. It's probably one of the easiest and most rememberable ways to warm up the breath. There are many, many other techniques that do involve a straw. There's also some wonderful adaptations of Alexander technique, where the arm is in motion to help ensure that the hinges are loose while we're breathing. The shoulders, the sternum, and in between the shoulder blades. It's important to warm up your body before you warm up your breath, and we'll talk about that in about 4 slides. Hopefully I'll give you some more tips with that. I hope that at least started to answer the question. I do want to talk a little bit about disease and trauma, and again, I'm not a physician, but these are some of the things that we see in older adults, including TIA, stroke, traumatic brain injury. That's something that can happen at any time in life, really. Parkinson's disease, and I want to highlight that there are a number of organizations in the United States that specialize in voice therapy for people that are experiencing the symptoms of Parkinson's disease, including the Parkinson's Voice Project, which I believe is centered in Dallas but has programs all over the United States. Vocal nodules. So basically, a vocal nodule is a collection of cells on your vocal fold that means that the vocal folds don't meet together cleanly. There's a little bump, a little ridge in the vocal fold. Sometimes those can be treated. There are risks in treating those. If someone says you're pre-nodular, excuse me for just a moment. Pardon me. If someone says, if you speak to a voice professional and you're told that you're pre-nodular, there are treatments, there are therapies, and you will probably be referred to a speech-language pathologist as part of the overall treatment plan. Cognitive changes. We all experience cognitive changes. They seem to get worse as we age. Those can sometimes interfere with phonation or our ability to speak or sing. Injury due to fall has all kinds of implications, including changes to mobility, or there are changes in mobility that make it difficult to get full respiration. And I'll follow up with arthritis here. There are many different kinds of arthritis. Osteoarthritis seems to be the most prominent in older adults. Again, being able to move the upper body for full respiration, keeping the head, keeping the skull on top of the spine. Sometimes we experience changes to posture as a result of arthritis. Those things will all affect our singing. And then here's one that I think is important that we don't talk about often, is thyroid and endocrine illnesses. Changes to hormone levels in the body will affect the voice. Obviously, if there are certain kinds of hormones that are either in excess or not enough of, then we will have changes to the thickness or thinness of the vocal cords, and those they can result in hoarseness. There are many symptoms that go along with that. But if this goes along with that sudden changes in the voice that we talked about earlier. So if we're at this point, if you notice these things, you might discuss with your medical professional whether or not this could be something relative to a change in endocrine as well. Gary, are there other?
Yeah, one great one at this point. Let me know if you want me to interrupt you less.
No, this is great.
These are great questions, and they're coming in at great times relative to each slide. Several of those things that you just mentioned can create inflammation. How does inflammation affect the vocal mechanism, the anatomy?
Yeah, we're going to talk about that in 2 slides.
Got it.
Under the laryngitis laryngitis topic. Absolutely. Other factors affecting the voice. I just want to get through this so that we can actually talk about what happens. Medications can definitely affect the voice. Everything ranging from Benadryl to high blood pressure medication. Speaking of Benadryl, allergies will affect the voice. And we live in the Pacific Northwest where we have glorious fir trees. And springtime can be, especially tree pollen, can be a very difficult time for singers. Tooth loss and dentures, another thing that will affect our voice. TMJ syndrome, the joint here. People experience tightness in the inability to open the jaw as far. Digestive changes, acid reflux. A lot of people experience acid reflux. This is the acid reflux can affect the lining of the vocal tract and the nasopharynx, rather. Menopause, we've talked about. Women on hormone replacement therapy may experience changes to the voice that could use coaching or help or therapy. Depression, mental health symptoms, these are also things that can affect the voice. And we talk more and more about trauma and the effect of trauma on the voice. Some folks are familiar with polyvagal theory or the vagal response in the nervous system and how trauma affects that. Those are all things that we consider in the voice studio. So what's going on? So laryngitis, which is essentially inflammation of the vocal cords, is generally considered a temporary condition. If laryngitis doesn't go away, it's probably not just laryngitis. There's probably something else going on. And we should talk to our voice professional or a medical professional about that. We talked earlier about dysphonia just being a general term for difficulty with the voice. And then there's aphonia. Aphonia is a loss of speech. And those things are, that's definitely a point at which you want to be involving your medical professional in evaluating your circumstances. Okay, so now here's one: tremolo, tremor, or wobble. We have as singers age, there are changes to the natural vibrato of the voice, and to be honest, we don't know everything we want to know about how vibrato works. It is a natural feature of the voice. It is something that I hope that voice professionals encourage in their singers over time, because the tendency to restrict the voice and stay in straight tone for long periods of time means that we develop problems with registration later on. Tremolo really is actually a very, very, very fast version of vibrato that it's more of a ooh sort of sound. And then wobble, whoa, 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 is an oscillation. It's very wide oscillation, and there's often very little sense of where the middle of the pitch is with wobble. Tremor, or sometimes it's called essential tremor, is generally associated with Parkinson's. And sometimes people that are experiencing the symptoms of Parkinson's have a tremor in the voice, and sometimes they don't. I believe Diane Rehm is an example of someone who was experiencing essential tremor in her professional career, NPR reporter. There are treatments that can help in many cases. In some cases, sometimes we're working for just maintaining the condition or the state of the voice. But all of these things are good to check in with your voice professional about. Edema is, Reinke's edema in particular, is generally associated with smoking. You might think of smoker's voice, and this is a really serious form of inflammation that that's persistent and basically will not go away because the tissue in the vocal folds has been so damaged. As we take in the chemicals of cigarettes or other kinds of inhalants over a long period of time, the vocal cords try to protect themselves by swelling, by adding fluid to the tissue, and eventually you develop scar tissue, and that edema, that swelling, just simply stays, and that's where we get that sort of smoker's voice from. Presbylaryngis, or vocal atrophy, can take a couple of different forms, but sometimes we talk about bowed vocal cords. The tissue itself simply starts to shrink, and the vocal folds don't meet quite as completely. We use generally semi-occluded vocal tract techniques, postures to help with that, and we're going to cover SVOT here in just a little bit. Loss of range is common in changes to the voice. And then difficulty during registration changes. So getting from chest voice to head voice, sometimes that registration event becomes more static. I tend to talk about registration changes in terms of dynamic and static. So if I'm singing in my chest voice, that's a dynamic registration change. If I have a static registration event or registration change, those are sometimes termed a break. I try to avoid break as a term in voice instruction. Those can often be helped with good voice instruction. All right, before I go on to the 5 steps of resilience, Gary, are there any other questions?
We do. We have a few great ones here. One, Casey talked about having a severe TMJ,
Yep.
and finds that they actually have to place a finger on the jaw to center their jaw to get it to work right.
I actually, my dental professional was the person that I talked to about because I have a lot of jaw tension, or was experiencing jaw tension for a long time. And they actually, my dental professional was actually able to massage and help loosen up some of the tension that I had. Also, ice. Using like you can even use a popsicle, and you can use a popsicle to help sort of with the muscle tension in the back. But dental professional or an ENT to talk about that. But yeah, one of the things that I like to tell my students is that you actually need to have more space between your back teeth than your front teeth, as a way to help know how far that jaw has to move when you're singing. I don't know if that was helpful, or Casey, if that helped you at all, or if that responded.
That's fascinating. Now I'm trying to hold my mouth like that. Oh, it's a good thing I'm not on video. Which I'm sure be look like trying a hippo.
Yeah, there's about 100 people right now going, how do you get your back teeth apart? Yeah.
A question too about laryngitis and about the temporariness of it. Is there a point that you would recommend if it's lasted a certain length before seeking medical help? You talked a little about this earlier.
Yeah, I think if laryngitis, I mean, most people know their body. If laryngitis persists more than 3 to 5 days, I would say check in. If you know that it's because you have a cold or the flu or some other, actually, I should pull that back. If you've had a viral infection of some kind and your laryngitis persists, absolutely go seek medical professional help. Medical help, because there is a condition called vocal fold paresis that can be the result of a viral infection. That's one of the ways vocal fold paresis can occur. So 3 to 5 days of laryngitis, it's tolerable. After about 5 days, I would be seeking help.
3 to 5 days. We have another comment that suggests that night guards can help with dental issues. I know that's certainly been the case for me, to assist with jaw relaxation.
Yep.
I think our last question, perhaps from that section, is one that I actually have. I was intrigued by presbylaryngis, and wondering, since we are choral musicians, if you can also address lutholaryngus and episcopolaryngis and methodolaryngis, or any other options?
A number of jokes come to mind right now. None of them are appropriate in this forum.
I don't know that one was either.
Yeah.
Thanks very much, Scott. Let's proceed.
As an episcopolaryngis, I'm
Laryngis, Judaica laryngis. You could keep going. All right, I'll stop now.
All right, Gary. Where are we at? Any more questions that I should catch up to?
That's it.
Okay, great. I want to talk about the 5 steps to vocal resilience. This is, I think all good lists should be able to fit on your hand. So these are my 5 steps to vocal resilience, and these, I believe, are the 5 steps, the 5 pedagogical in order steps of good warm-up, of good vocal teaching. And it's body, breath, phonation, right? Intonation, which doesn't mean what we think it does, or what we might think it does, and registration. So body means making sure that the hinges move freely. Hinge here, hinge here, hinge here, hinge here, hinge here. We want to make absolutely sure that the muscles that have been tightened up, especially the long muscles of the throat, by driving, by computering, by whatever we're doing. Yes, I just made computer into a verb. All of those things can move freely so that the vocal mechanism can move easily, so that there's no tongue tension. Don't forget that sometimes you need to release the tongue as well, and that respiration can be as full and as active as possible. Then we want to make sure that the breath is active. Sometimes we talk about breathing in through a straw shape. I did earlier. The reason for breathing in through a straw shape is because that the restriction of the mouth, the lips, automatically correlates to a restriction in the throat muscles. So when you make an U shape, the throat is narrow. When you make an E shape, E, E, the throat is wider. And when you make an ah shape, ah, ah, the throat is at its widest. So when you breathe in through an U shape, you are narrowing the tube all the way down to here, or at least down to here, rather. And you are accelerating the air. You're using gas dynamics to accelerate the air. So you're more likely to get a full breath. There are some other techniques, including the surprise breath, which will also engage the muscles of the face as you breathe. Phonation. Phonation should be gentle at first, and I strongly advise using stretchy phonation, using slides, glides to start your phonation with. For some folks, it's easier to start from the top. And go down in half-step increments. And for some folks, you want to do rising thirds. But you'll notice that I'm not going. We want to stretch those chords. We want to stretch the mechanism. We don't want to start making discrete stepwise changes until we've started to just sort of get the voice moving. And then phonation, you all know many warm-ups that will help you sort of get things moving. But I want to talk about intonation for a second. Intonation is not sharp or flat. Intonation is vowel placement. Something can sound sharp or flat and be out of tune, but generally we want to talk about vowel placement as assisting in the balance between breath and phonation, as it's the assisting point. So make sure that the vowels that you choose are well rehearsed and in the right place for your voice. I like to use key, 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 making sure that the half steps and the whole steps are accurate. There are many other ways to practice intonation, but just making sure nasality is another way to work on intonation. Nya, 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 nya. And I know I'm really rushing through all this stuff, folks. I've got about another 10 minutes left, so I want to make sure I get to everything. And then registration are those places where the voice changes from one tone or to the other. So we go from chest voice to head voice. There's a lot of discussion about mix and what that means. But generally, we want to start warming up. Generally, we want to start warming up in the same place that our speaking voice is, and then make travel across the registration happen later on in the warm-up. So the registration change. So, and registration change exercises can be done easily with octaves and with arpeggios. So ho ha ho ha ho ho ha ho ha ho he 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 he. I'm already starting to mix as I get up there. Oh, how I love to sing. Oh, how I love to sing. I moved a little bit too quickly there, but you get the idea. So those are, that's the pedagogy of vocal resilience and staying, and I would typically warm you up if you were in my studio in that order every single time. Okay, I'm going to move on from that. I know you all have questions about that. I do want to talk about bubble phonation really quickly. Pardon me while I get this. Semi-occluded vocal tract postures, semi-occluded vocal tract therapy, semi-occluded vocal tract. It just means that we're doing something to restrict the airflow out of our mouth. It increases the suprapharyngeal air pressure or the intraoral pressure relative to the subglottal air pressure. What it does is it creates a more efficient environment for your vocal cords to vibrate in. You can use your lips and tongue to do SOVT. You can humming is technically an example of SVOT. Lip trills, also a great one. And then my personal favorite, And one that has become more and more popular over the last decade and a half is straw phonation. And the benefit to straw phonation is that when you add a straw, you are increasing the length of the tube after the vocal mechanism. So you've got a fairly long tube from your lungs to your larynx, but the tube from your larynx to the tip of the lips is much shorter. By adding a straw, you are making the tube, the air tube of the vocal mechanism, longer, making it more possible to balance subglottal and intraoral air pressure. The diameter of the straw is important. Obviously, or maybe not obviously, the narrower the straw, in this case my orange straw is my narrowest, the higher the air resistance. I also have these red straws, which have a much higher diameter. My preference, honestly, is a Starbucks straw. It's my personal favorite. But what I am going to share with you right now is what I call what is called bubble phonation. And I have my trusty pink straw. And if any of my voice students are in the room right now, you'll recognize my trusty pink straw. And what I also have here is a Starbucks glass, and I'm going to hold it up. As a matter of fact, why don't I do this? I'm actually going to stop screen sharing at this point to give you all a better view. I don't know if you can. Is this more helpful? Is this helpful? So I have a Starbucks glass here. I've recycled the bring your own cup, and there's water from here to here in the glass, and I have 3 marks on the glass. 1 for 2 inches of water, 1 for 1 inch of water. Straw goes in. Got to take the lid off. Sorry, folks. Otherwise, it's too airtight and it doesn't work. Talk about gas dynamics, right?
Also, right. Scott, if you're going to show the whole cup, let's make sure we can see the bottom of the cup.
Yeah.
That last moment it was on the top.
So,
cool.
I'm going to give you 3 exercises using the bubble technique. So there's about 1 inch of water in here, or there's about 1 inch of water above the bottom of the straw. We want to make sure that the bubbles are consistent and even. And the first one that I generally give students to use is 3 low. I call it 3 low blasts. It's as low in the voice as you can. My voice is already feeling better. It's an amazing effect. What the bubbles will also, they have a sort of they have an effect through the air column that actually massages the vocal mechanism a little bit. It's like giving your vocal cords a little massage. The second step is a 5-note slide up and down. And you can do that through the first registration change. And then the next step is to actually hum a short tune into the straw. But you can see that I'm keeping the bubbles consistent, and I'm breezing through the straw and water technique just to introduce you to the idea. In the handout that I gave you are links to both Ingo Tietze's demonstration of straw technique and a very good demonstration of bubble technique, of bubble phonation. So please do refer to those as a much more extended look into this particular technique. It's very helpful in helping reconnect vocal cords that have experienced some atrophy and some loss of muscle tone, because it creates it helps balance registration and phonation, and it strengthens those sub processes in the vocal mechanism. It just requires less effort to phonate that way. So if you are a person who has to really get the air out in order to phonate, try the straw and bubble technique as a way to sort of reduce the amount of stress on the vocal mechanisms, particularly on the vocal cords and those softer straw. I assume no hard one. I'm using plastic straws, which may not be the best thing for the world we live in, but I reuse them all. I stick them all in the dishwasher when I'm done with them. I don't recommend using a bendy straw because the bendy straw changes the dynamic of the restriction in the airflow. Let me just make sure that I haven't missed anything.
Would that include a bendy straw even if it's not bent at that moment?
No.
It's great, but it has those
bumps. Yeah, right. Just to kind of go back to, just to conclude a few things here. I think I'm almost at my hour. Ask to be moved. If you are singing in a section and you are struggling, if you're singing in a section in your choir and you are struggling, and you feel that you would be having a better experience as a mezzo-soprano or an alto, a second soprano or an alto, or if you feel like you could be moved from tenor to bass or vice versa, because men's voices sometimes end up a little higher as we get older, please ask your conductor to move you and to consider trying changing sections for a concert. I can attest to the number of people in my choirs and in the choirs of my colleagues that have had a much better experience simply by saying, "Hey, Gary, would you be willing to let me sing alto on this concert?" Keep your body.
My answer will always be yes, Scott. You can sing alto anytime you want, or anybody else.
Keep your body moving. Exercise is important. Alexander technique is a great tool for all of us, and I'm hoping to add a little bit more to my Alexander technique vocabulary, and over time there are several excellent experts in town on Alexander technique. It's a good tool for musicians. Stay hydrated.
Can you say a little more about what Alexander technique means?
Yeah, so my colleague Adam Burdick is in the room, so I'm probably going to embarrass myself just a little bit when I say this, but Alexander technique was originally developed as I believe his name was Richard Alexander, who was an actor, and was experiencing some really traumatic vocal symptoms on stage. So he found a series of ways to relate to his body that helped him with his breathing and improved his performance in general. So Alexander technique involves connecting body and breath specifically, and having primary control of the breath while we're singing or acting or speaking. Hydration is important. Keep drinking water. We all love our soda, we all love our coffee, we all love our caffeine. For every caffeinated beverage, there has to be a glass of water that goes with it.
That includes tea.
That includes tea, folks, yes. Don't forget to breathe. Breathing is everything as singers. Keeping our lungs as active as we can. Take a couple minutes in the middle of your day to do some deep breathing, sense the breath, and connect the breath with body, mind, and voice. And then keep singing. This is what I was talking about earlier. Our resiliency relies on continuing to sing, and I know in these times that's very hard to do. Some of you are doing isolation choirs or virtual choirs. That can be a scary experience. But it is certainly a way to keep the voice going. Singing in the car, singing along. There are great recordings. I know that one of the things that I like to do right now, I'm very fortunate that there are some CDs of music that I contributed to, and I sing along with those as a way to keep my choral voice active. I know the bass part to that, and I sing the bass part along with that. All right, I have hit. I'm 2 minutes over, Gary. I'm sorry. With that,
your sins be forgiven you, especially since I think I went 12 minutes over. So.
Well, and to be honest, The material in this class was designed for another event that would have taken place over 4 days. So I just went through 4 hours worth of material in 60 minutes. So
well, we have a few good questions here too that I think we can address.
Sure.
Some of them are relatively quick. Some suggestions about using Tai Chi or massage in order to help the hinges move, especially if you have posture issues or
Excellent.
matters like that. One question is your thoughts on circular breathing, how it applies to this.
I wonder if this is coming from an instrumentalist or not.
Let's see. I could find the name. I could name somebody. Let's see. I'm not finding it readily. No.
Okay. Well, I mean, if we're talking about circular breathing with respect to how instrumentalists are able to, oboists are able to keep really, really long phrases going, it's a very useful tool. Yeah, yeah. Oh, it's Nikki. Oh, sure. Yeah. Oh, it can be a very useful tool. I personally think that, oh, and Nikki, you're going to probably disagree with me, and you're allowed to. I think that circular breathing results in shallow tone for singers. I think being able to fully respirate, inhale, we need that, the action of the breath all the way through the wind tube down into the lungs with the diaphragm being able to do its job.
Question 2 regarding the frequency. How often do you recommend that somebody practice or do the warm-up exercise or something, especially on their own now that we're all singing at home?
So if you sing for 10 to 15 minutes 3 times a week, 10 to 15 minutes 3 times a week, and that means a reasonable warm-up and sing through something. Sing through a hymn, sing through a part song. Yeah.
Also, metal straws work?
Yeah.
Cool.
You bet. Yeah.
We have a couple of questions about very specific situations, but I think they're all 3 good ones, but I'm going to limit it at those 3 that are in. One is regarding asthmatic singers who are often out of breath, how they can develop better projection and ability to sustain while singing without sliding their pitch while they're in the middle of it or sneaking in breaths.
Honestly, the semi-occluded vocal tract work is, I happen to have some breathing issues. I keep a rescue inhaler nearby. I'm on Flovent. And the semi-occluded vocal tract exercises are an excellent way for folks experiencing symptoms from asthma or other respiratory disorders. Yeah, to improve.
Cool. And when you're doing the straw phonation, a nice lead in, how would you recommend for folks who are struggling to move through the passaggio smoothly or kind of break dramatically when they're doing that?
Well, that requires some listening on the part of the voice professional, because it can be a number of things. If it's it could be mechanical, it could be something else, that's causing that. In general, here's my general advice about having issues with registration events. Decrescendo, increase your air. So increase your airflow as you're approaching your registration event, and actually decrescendo. Don't try to increase the amount of volume. It has there's a tendency to sort of tighten the vocalis muscles as we get closer to that registration event. It's sort of a fear factor thing. Maybe that's incorrect, but we start getting tense as we know that we're about to approach the registration event. And our bodies, we don't have to know what pitch it is. I mean, if my registration pivot, if I pivot at C sharp, I don't have to know that I'm coming up to C sharp. My body knows that C sharp is coming, and all of a sudden I can feel my tongue go and everything go like this. And what I know I have to do is actually lighten up a little bit as I go over. I have to increase the amount of air, keep the air flowing, even though I'm getting softer as I go through that registration event. That's my first best advice.
That's fantastic. And this will be our last question then. What do you recommend for specific exercises to address the wide vibrato? You talked about 3 different types of vibrato and wobble and such.
Yeah.
What exercises do you recommend for those?
There are a number of different approaches, and some of them are philosophically different for pretty fundamental reasons. Sometimes issues with vibrato are going to be, the care of the vibrato is going to be palliative. In other words, there may not be much, depending on if it's tremolo or vibrato. If we're talking about getting out of straight tone technique, right, constantly singing straight tone, there are a number of techniques recommended by Richard Miller, including oscillating between half steps, and speeding those up over time. Because a lot of singers have been trained to sing nothing but straight tone their entire life. And so sometimes we have to break the habit of singing exclusively in straight tone. If we're talking about wobble or tremolo, those definitely require a little bit of time with a voice professional to determine the best approach. I do recommend, again, semi-occluded vocal tract therapy as a way of helping to retrain the muscles. A lot of times, but the physiological changes in the voice sometimes have to do with the fact that our nerves are firing at a lower frequency as we get older. And so our ability to control, and this is all very theoretical, folks, because we don't actually know, the ability to control that vibrato or the range becomes more difficult. So decreasing the stress on the vocal mechanism while phonating is one way to practice that and allow those muscles to and the nerves to sort of relearn or build fresh sort of neural behaviors with less stress, so that there's less electrical energy, there's less energy required for more even phonation. I hope that made sense. I just sort of jumped into sort of vocal acoustic stuff that's, yeah.
I think it's been fantastic, and thank you for all of this. I have learned so much. This is the one I think I really need to rewatch about 4 or 5 times to get it all. Thank you also to all of our participants for your questions and your contributions. Today's session is exciting. This marks the conclusion of the first series of Emerald Choral Academy, and we're pleased to announce that we are already actively engaged in raising funds and recruiting instructors for a second series. Hooray, hooray. That will begin probably in January. You can, as always, continue to help support these efforts by donating at emeraldensemble.org. You can also let us know topics that you would like to see discussed, and we'll send you out a, I think, survey also shortly. So we're hoping that this academy becomes a permanent fixture of the Emerald Ensemble's activities. And in order for that to happen, we are very grateful for the enthusiasm for you, who are our audiences and supporters. In the meantime, thank you very much again, Scott. I am Gary Cannon. On behalf of all of the Emerald Ensemble, I wish you good physical, mental, and musical health. Thank you all. There endeth the official event. The last 2 comments